Good afternoon, ladies and gentlemen. It is indeed a new day, a bright Sunday, a day that the Lord has made, that we should all be glad and rejoice in it. We don't want this day, which other day to you as an individual prefer. I'm so happy to have a day like this. Indeed, the sun is shining. Therefore, we should all be glad and invite our friends and family to join us this afternoon as we discuss the preventive measures of fibroid. At the end of the day, we will understand what a fibroid is, and we will know the difference between fibroid and chemo, or when fibroid develops into chemo, and what we can do to prevent ourselves from it in order not to get such problem. I know as women, it's part of us, but it's not everyone that will have it. But even if you have it, how do you survive with it? Is there a treatment for it? Now I will invite my guests with us this afternoon. The first one is Mr. George Ackon. Brother George, you're welcome once again to Richmond Media.
Thank you.
How are you today?
I'm highly favored by His grace. And you?
I'm also being favored, even more than the word favored. I don't know how to describe it, but I'm so grateful to the Lord. As the topic stated, is all about fibroid. So, could you please, but beforehand, let me say you're welcome to everyone, our friends and family, please. Don't hesitate to invite your friends and family to join us, because this topic is very, very important. As women, and even if you are not a woman, you have a sister, a brother, a wife, auntie, mother, that you can also share this preventive measures with that person. But George, what is the overview of this topic at all, fibroid?
Okay. Thank you. And we want to welcome our viewers and our listeners to this afternoon's health issues from Richmond Media. Remember, your health is our concern. So as we are about to deliberate on it, the overview of this lesson, fibroid, is that we are experiencing rampant increase of this condition among our ladies. And we thought it wise that as Richmond Media health issues, we need to raise the alarm so that we can know how our dear females can be able to maintain the health of the reproductive organ by not developing this fibroid. So today, as we will be discussing, diving into, we have a viewer who has not suffered fibroid. And we have a viewer who is also suffering from this condition. But we are hoping that at the end of today's lesson, the one who has not gotten it and the one who is into it, the one who has even done surgery and has had relapse and things, we will know some various preventive measures so that we can maintain the health of the reproductive organ. Thank you.
Thank you so much, Brother George, for giving us this in-depth overview of fibroid. When we talk about fibroid, everyone thinks, or most of the people think, that fibroid is definitely going to be a chemo, or once the person is experiencing some symptoms of fibroid, definitely is going to turn into that. But could you, for us to understand the topic very well, would you be able to give us a bit explanation about tumor. Then we can go into the topic. We can digest it. Thank you.
Okay, thank you. But we want to raise a caution here. The pictures, the presentations, the discussion is just for educational purpose. And if anyone wants to go deeper into it, you need to consult and discuss with your healthcare provider so that any implementation concerning our presentation you can implement with the advice from your physician. Thank you. So when we talk about tumor is a word that is big, but in simplest term, it means that wherever there is a body, like the female reproductive organ, there are cells, and these cells helps with the normal growth, normal maintenance, normal pregnancy, anything that goes on within the reproductive organ. That is what it does. But a tumor will come when there is an abnormal growth or abnormal mass of tissues which may occur within the uterus, and in that case we will term it as uterine fibroid. So males don't get fibroid, uterine fibroid, but females do have, because they are having the uterus. And that is the little explanation of when you talk about tumor, just an abnormal growth that occurred at a particular place. But in this case, because we are talking about uterus or uterine fibroid, meaning the abnormal growth occurred in the uterus, which we can see in the females. So we get the female uterine fibroid, but not male don't have uterus to get fibroid. Thank you.
Thank you so much for that clarification, because nowadays you can't say that male don't have uterus because some of them think that they can conceive. So how they do it is up to them. But we are talking about the nature. Thank you so much. If that is the case, brother, could you give us or could you let us know what a fibroid is?
Okay, so a tumor is what we just explained. So by looking at the picture here, you can see that per where I am sitting, the left side looks very nice. The left side, the left picture looks very nice, which means effective blood supply is going into the uterus. Proper things are in order. So nothing like abnormal growth is occurring in the left side per where I am sitting. But in the right side, you see under it, we are saying uterine fibroid. And in that case, it means that that is how the abnormal growth has occurred. So in fibroid, we have at times our viewer or our listener can visit a healthcare provider or a gynecologist. Then after the investigations that we will be studying, you realize they will say myoma is the same thing. So it has nicknames. The fibroid has nicknames. So they can call it myoma. Is the same thing, but they can be cancerous or non-cancerous. But mostly what we experience or what they have more or care more is non-cancerous, which means that the abnormal growth that will occur in the uterus initially will not be cancerous. But if you still sit, continue to do whatever we are about to go into, and it's complicating, that is where it will lead to cancerous, which means it will lead to cancer. So they grow within the walls of the uterus. And that is how the abnormal growth occurs. It grows within the walls of the uterus, and it can either be small or large. It can either be single or multiple. And that is what we will dive into it in our lesson. So incidents, we can say 20 to 40% of reproductive age women experience it. That's why Richmond Media Health Issues has noted that we need to help our dear women so that we can create the alarm that Fibroid is also increasing, like how malaria and things is occurring, of which at first it wasn't like that. So we need to pay much attention and know how to help prevent ourselves from this condition. Thank you.
Thank you so much, Brother George. As I initially introduced my guests, I said we have two, but the other one has just joined us. Therefore, he needs to be introduced to everyone so that you know that he is also existing on this platform. Brother Aikins, you are welcome to Richmond Media. Brother Aikins, you are welcome to Richmond Media.
Hi.
Thank you.
Thank you, Sister Bema.
You're welcome. As the program continues, now that we know what a fibroid is, there are so many things that can lead into that. So, therefore, my guests will explain to us the risk factors of fibroid. Thank you. Hello?
Yeah, I think if Aikins, you can hear us, you can take it from there.
Okay, thank you, Sister Bema.
You're welcome.
I would like to talk about the cause or the risk factors of factor that predispose someone to get fibroid or leiomyomas. As my brother just said, it has so many names. We can call it myoma or leiomyoma or fibroid for a layman. Hello,
We are listening
please,
to
can
you,
you hear me?
brother. Yes, please. Brother George, please can you take over as we wait for Brother Aikins? Thank you.
Okay, so as we are waiting for Aikins, when we talk about the risk factors, with the risk factors, we are saying that considering a group of women who are in our system, we have a category of a group of them who are at higher risk, which means their chances of getting fibroid is higher compared to another group who is not having this fibroid. So that's where we want to create the awareness. And the first one, those at higher risk, age comes into play, like roughly the ages of 35 to 45 years. Between that age, we are saying that if a female is not taking good care of herself and has attained this stage, and he's likely to suffer from a reproductive problem, then she stand at a higher risk or chance of getting uterine fibroid. Another aspect is individuals who have history of fibroid. It doesn't mean that because your mother is suffering from fibroid, it means guarantee that you, the daughter, will get it. No, but there's a higher risk chance that whatever lifestyle, whatever things your mother was eating, your mother inculcates, can also influence your chances if you also go in her line. And in that case, you stand at a higher risk. That's why family history also come to play. Then also individuals who are obese, So obesity compared to someone who is not obese, you stand at a higher risk or chances of getting uterine fibroid as a female compared to the other person. Then who also had his menses at the early stage. We are saying the teens, but we have some individuals now, because of things that increase hormonal factors and things, some do menstruate even at the age of 10, 8, and the rest. So if an individual comparing two women or two females, but one had the menses at the early stage compared to the other category who had it at the normal stage, and we want to compare them based on their risk, then the one who had it at the early stage stand the chances of getting this fibroid that we are talking about. Then individuals with some medical condition like diabetes, this is that there's a problem with your blood vessels, there's a problem with your blood circulation, and with the reproductive organ, it's connected with blood vessels. At the same time, a healthy blood needs to supply to that area. So if a female is suffering from diabetes, it means the problem with the blood and the vessels will impair free circulation of quality blood to the reproductive organ. And when that occurs, it means the cells will not get nutritious blood or oxygenated quality blood. And at that stance, you stand at a higher risk of getting this condition. Same to our women who are suffering from hypertension, which also involves the heart, the blood, and the blood vessels. But these people have the decreased risk. A woman who exercise, eat varieties of the greens and the rest, stand at a higher risk or a decreased risk of getting this condition. So these are some of the risk factors that we need to look out for and pay much attention to when it comes to the issues of fibroid. Thank you.
Thank you so much, Brother George. Brother George, I have a question before we continue. If you made mention of if they don't take good care of themselves as women, then they are at high risk. What kind of caretaking are you talking about, please?
Okay, thank you. My kind of caretaking is one, when you take the organ, which is the reproductive with the food that you eat, that will give it quality blood. Second one, it's being fed with the same blood. So it comes from what you smoke or what you inhale. Another aspect is your lifestyle. If you are a female, currently as we speak, people are taking contraceptives like water. And as they are taking it, it means they are doing wrong lifestyle. And they know that they have an emergency exit. It will change their hormonal function. And hormonal imbalance can lead to this condition, fibroid. So if your diet is not well, your sexual life, you are not controlling it well, then you eat anyhow, you drink anyhow, then it means that aside the food aspect, aside the other lifestyle, you are at risk. That's why when we get to the preventive, well, we will dive deeper. You see, most ladies now, they don't even like cooking. All their foods are from bottle and cans. And most are being processed, which affect the liver, which is supposed to regulate this hormone, the sex hormone. And when that happens and you are getting a fibroid from hormonal imbalance, you stand at a higher risk. That's why we want our viewers to understand. Thank you.
Thank you so much, Brother George, for giving us that in-depth understanding of how we can take good care of ourselves in order not to get fibroid. Now that we know the risk factors, then definitely we have to know what exactly causes fibroid. Thank you.
Okay. So with the causes, we are saying that for our viewers to get a clearer picture, one, God created you, the female, the reproductive system, especially your uterus, in a smooth way that nothing should overgrow. So when you engage in series of the things that we are about to mention, and there is an overgrowth, it will arise from the smooth muscle cells That is what we call the myometrium. Is the inner part of the uterus. So we don't want to bombard with terms and things, but what you need to understand is that when things affect the cells, that is where growth is being occurred. Then it's not from the a quality source. It impairs the proper functioning. Then it will lead to abnormal growth. But it's like a tree. When you put the seed on the ground, it will germinate from the soil before you see it outward. So before you can see the abnormal overgrowth as you are seeing on our screen, it means it has gotten its root from the inner smooth muscles, and that is what we are terming as the myometrium. So we have various factors that can cause that, but we need to understand that that's how it occurs. We are saying genetics. Genetics comes with our makeup, not the makeup they do in their face, but our body makeup. What constitutes you as Auntie Bema? What constitutes I've seen Sister Christiana Sapon? What constitutes Sister Christiana Sapon? Those things are what we are calling the makeup. So if there are some abnormalities when it comes to the chromosomal arrangement, then you are likely to get some malformation of that arrangement, and you can get this condition that we are talking about. That's why the genetic factors in a layman's perspective can come to play. Then we are saying that estrogen, for a female, we have the estrogen and progesterone, then little of testosterone. They are sex hormone. Our viewers and our listeners, these are just terms, but it's just simple things. But what we are saying that when we talk about the estrogen, it's a hormone that helps line your uterus. God is so wonderful, so special, very nice person that before you will lay your egg, there should be a mat that lines your uterus. And it's the work of the estrogen to help you lay or line your uterus. Now, when you have problem with estrogen imbalance, in a way where estrogen will overgrow or overproduce, then we are saying that it can also lead to or complicate your abnormal growth. So let me put it in this way. Let's say you have a single room. Then in that single room, you went to buy 2 rooms carpet, which means when you use one room, the leftover of the carpet, you need to fold it under the first carpet. And that is how the fibroid do occurs. When estrogen comes and there's an abnormal growth, or that will speed its work because of overgrowth, so it will be like a carpet overfolding. Then the mass or the tumor will be protruding. Then it will be enlarging, depending on where it's not getting the effect. Then that can cause that. So estrogen is one hormone that, although they are saying that it has not been proved for causing myoma, but it can implicate its growth. So a hormone to feed the cancer cells, estrogen, is uncommon before puberty. Puberty, puberty, right, where armpit growth and things. So it's just uncommon. When you've not menstruated, you are not likely to get fibroid. So that is what we are saying. But it's common in obese women and may increase during pregnancy. And studies shown high concentration of estrogen receptors in, we are saying fibroid can be called myoma or leiomyoma than in the myometrium. So you can get to know that quickly. What are some of the things that can lead to increased risk of estrogen or increase estrogen into my system as a female that can affect the normal growth of my uterus? Number one, from the sources of estrogen is oral contraceptives and some birth control pills. So that's what I was saying when Auntie Bema, you asked about what are some of the lifestyles. You realize that most women now, it's so funny that and unfortunate, but we think we are smart. We will sleep with this person, take their money, go and sleep with this person, sleep with this person. But we know we are not married, we don't have family, but we are planning our family. So we are going with the oral contraceptives. And most of the birth control medications are hormonal, and it will affect or change the hormonal ability of you. That's why initially that female was having a regular flow, a normal this number of days flow, but it will get to a point in time that when he starts abusing these drugs, then to a point he can have prolonged bleeding. He can miss some months of menstruation. So some people will have 2 months they've not menstruated, 3 months they've not menstruated. Why? Because of this hormonal contraceptives. So our viewers, they need to be careful of that. Then another aspect is some ingredients in some of the processed plastics, processed foods that we are taking, and some ingredients in our perfumes, some of our perfumes. You know, we want to look, when we pass by, people should turn and look at us again. Yes, we have essential oils that you can use to make your perfume. That is so aromatic that when you pass by, yes, people will look back to you. But if you are using a harmful ingredient in the perfume you are using, it will disrupt your endocrine system and it will elevate your estrogen. So we have some women who have used this as a lifestyle, what they apply on their armpits, what they apply in their lips and things. And because it has become their lifestyle, now it is affecting their hormonal change and is leading to higher increase of estrogen. And we need to be mindful of that. Then also, you see, some people also have problem with hormones or hormonal issues. So as part of the treatment, we will use like hormone replacement therapies. That's hormone replacement therapies, treatment that we use in replacing the hormones that they are lacking. And when we are doing this, estrogen and progesterone are the hormones that will goes in. But as a top-up hormone, you are likely to get the imbalance. So you need to be careful and always, you know, your prescriber will just guide you and know what is best for you. So we need to do that. Another source of estrogen currently, and that is common, is dairy milk and its byproduct. You see, research have proven that milk from the pregnant cow contains a lot of estrogen, and that is also the most common ones that is out there. And individual, our dear women who are interested and are addicted to cow's milk, instead of the tiger nut milk, coconut milk, the nut milks, you are likely to get higher increase of estrogen level. And when that comes into your system, the research have proven that about 33 times as much estrogen as in that milk compared to the non-pregnant cows. And currently, the chickens that they are taking, the eggs that are out there, because the farmers, they are thinking of how big the eggs should be and how the money they will get. They are concentrating on the profits, but not our health. So currently, most of these animal fishing industries are using a lot of things that will just increase the growth. And if you are consuming, there's likelihood of these hormones causing imbalance in your system. So we need to be mindful about these things as well. Then excess fat on the body. If you realize that you are increasing excess fat or you are increasing in weight, then you need to think twice, because when estrogen is getting higher or the level is increasing in you, it also affects your weight, and you are likely to be obese. So we need to be mindful. We are talking about the estrogen source because it's one of the causes that can lead or speed the growth of the fibroid within the system. Thank you.
Thank you so much, Brother George, for giving us this in-depth explanation that is giving us in-depth understanding of the causes of fibroid. At this moment, I would like to extend our appreciation to some of our viewers. Sister Christiana Sapon, says, God bless you. Important topic. Thank you so much, Sister Christiana. Sister Harriet Chemfua says, good afternoon. And then Sister Victoria also says, good afternoon, Doctor. And then there is another Sister Victoria Jagadu also say good afternoon, enjoying today's topic. Thank you so much for joining us this afternoon. Without you, it is impossible for us to broadcast this program. Therefore, we say, may God bless you as you also invite your family and friends to join us for this important topic, as you can also testify about it. Brother George, as we are getting closer, I think this topic will need to be broadcast in two different parts. But we will have another question and then we will end there so that you can have time, because it's really interesting when you have time to explain it step by step rather than as rushing. The next one is, what are the types of fiber? Because we talk about fiber, we don't even know that there are different types of it. But with your explanation, we will be able to understand the types that we have. So when someone is being diagnosed of it, the person can ask questions. When you go to your healthcare professionals, when you go to your doctors, your GPs, please don't feel shy to ask questions. Because when they tell you you have fibroid, you say, oh, I have fibroid. That's all that you can say. But now we are making it clear to you and everyone that there are types. So when they say that, don't just sit down. Ask them what type of it. And it is your duty as a doctor, as a medical or a healthcare professional to explain your condition to you. You will be able to understand what you have so that you will know how to live with it. Thank you, Brother George, as we listen to you.
Okay, thank you. We really love our viewers and our listeners to the extent that our ladies, we can't let you suffer the fibroid and lose things. Yes. So when it comes to fibroid, we have types. So per the explanation we gave when it comes to the myoma, we were saying that it can be one, either small or big or large. Then also it can be single or multiple. So we have a female who is suffering from fibroid, but her own might be small. So when you do your scan, of which when we get there, you know the series of things that you can even go and do and show to your provider. This is the scan I did. How can you interpret to me so that you'll be aware and be safe? Is that you will see that it's small. Then it means you can do something about it in a quicker way. But because it has also come, it will begin to from the small, then growing. Because if you are unlucky to identify it quickly, it means you continue to do the wrongs. You continue to do the things that contributes to the first invention, and that can speed its growth for it to become big. So we have the type, so either small or large. Number two, also it can be single. We have some people who is having only one, then we say single. But we have some people which can be two or three, then we can say multiple myoma or multiple fibroid. It's the same thing. So these are the things that you note. And another aspect too is that depending on the location where it has been placed, that is where it will give its name. So you see some individuals, they will tell them where it has been located and how big it has been. It means unless you do something about it quickly, else sperm cannot enter into the reproductive system for pregnancy to occur. And in that case, then it means that there's a problem. Then some individuals too, it can occur within the muscles, and that also comes with it also its name. Then some individuals also, it can occur within the body of the uterus, and that also gives it its name. So when you ask about the types, we have series of types. Number one, either small or large. Number two, either single or multiple. Then number three, depending on the location, that gives it its name. That's why some people, we can say, oh, this person is having the intramural fibroid, which means it's into. We don't want to, for the sake of our viewers, we don't want to be mentioning terms to confuse. But what we want our viewers in a layman perspective to understand is that, yes, when it's inside the uterus, it has its name. When it's in the muscles of the uterus, it has its name. When it's at the opening or the entrance of the uterus, it has its name. But the name will be given to depending on the location that you find itself. So per the picture, viewers' discretion is observed, because some people, you can see how they can see some things. Looking at the picture on the screen here, it's a fibroid. But you can see the top left side. You can see from a smallest, then to small, then to that big there. That's how it begins. So if it starts in that small, minute, like a fingertip stone, and you don't pay attention, it can lead to, or can grow to become big as that same table, what you are seeing there. So this is some of the pictorial of what we are discussing now. It's real. Fibroid is real, and it's at the increase. Then we need to note this is not anything. This is also some fibroid. Fibroids that some individuals has been worked on. You see how big that one also is. So it's something that we need to pay much attention to, because if you're having this in your uterus, it can let you become like someone who is pregnant. Your husband might be happy, my wife is pregnant, but you've not done UPT or pregnancy test to confirm, not knowing it's fibroid that has enlarged. But when we get to the clinical science that can let you know, I hope you will go deeper into it. But to this question, we have types of fibroid as well. Thank you.
Thank you so much, Brother George, for your time, for your love, explaining the preventive measures of fibroid, part one, to us. To our viewers and listeners, we say, may God bless you so much, because without you, it is impossible for us to bring this program to you, to your doorsteps, through Richmond Media. It has been a lovely afternoon, and I have enjoyed the program, so I'm very sure you have also enjoyed it. As the program will be continued next week, I would like to invite you to extend my invitation to you, or through you, to your family members and your friends, as we get into the deeper stage of preventive measures of fibroid. You will really understand it. Most of us are suffering from this. Sometimes, I don't know, we feel shy to let people know, but it is a condition. Or we don't even want to be associated ourselves to it, but meanwhile, you have it. Once you have it, it becomes part of you. So you have to find ways and measures to live with it and to survive with it, or seek for medical attention. But that advice, that measures will come from no other platform than Richmond Media. So it will be lovely and interesting to have you once again next week, Sunday, the same time at Richmond Media. That will be the 18th of August. I am blessed, and I know you are also blessed to have myself and my brother George Ackon, and brother Aikins, this afternoon through Richmond Media. Until then, the same time next week, Brother George, may God bless you. And to our viewers, we are all blessed. But until then, there is one comment from our sister Christiana says yes. So I think she was commenting on what I just said. So God bless all of us. God bless you, Sister Christiana, Sister Victoria, and Sister Victoria Jagaju, as well as Sister Harriet. The name will come. What continues will come afterwards. Otherwise, Sister Harriet, sorry, Gyamfi, that's the name. Yeah. And to the boss of Richmond Media, we say God bless you, and may you and the whole family be consoled as we, the viewers and the workers of Richmond Media, extend our condolences to you and your family. God bless us all.
Yeah,